You are listening to Prevention is the New Cure. All things health and NHS with a political twist.
And that's with me, Dr. Helen Stokes-Lampard, and with Steve Brown, former MP and chair of the Health Select Committee.
Hi, Helen. Welcome along. Episode 31 of our little podcast.
It's amazing how time flies, Steve. Do you know, it feels like it's been an eternity since in the last fortnight.
And we'll come on to that. Last time I was in the sunshine of Stockholm in Sweden, and you were on the way back or just got back with COVID from New Zealand.
Oh, I know. Yeah.
We had a big discussion, didn't we, about obesity causing more health well-being issues than even we knew. Weight loss drugs, talked about all of that. Wegovy. Anyway, are you recovered from your flirty strain, as it's known, technical term, of COVID?
Yes, thank you. Flirty and I have parted company, which is a great relief to all parties, I have to say. Although I actually managed to pass it on to my better half, Paul, who was not grateful for the gift of some virus. But anyway, fully recovered. But just to warn everybody, it turns out there's really quite a lot of COVID around. It's taking off again, although, of course, most people don't recognise it. So in other descriptive terms, there's a lot of nasty viral illnesses around. And if you get one, be kind to yourself and remember you are infectious to other people.
I keep thinking you got it on the plane. So if I were a DJ right now, I'd play the clip of COVID on the plane. You know the song, don't you?
No, I don't. Tell me.
Oh, Helen, honestly, there's a song with COVID on the plane in the lyrics.
Is there?
Anyway, yes, there is. Yes, Google COVID on the plane.
Okay,
and you'll play the song. It's called Season of the Sticks. Anyway, I digress. So, obviously, we're going to look a little bit back on the record in health of this government over 5 prime ministers and 14 years so far.
Yeah.
We thought we'd have a look at the achievements of the Health Select Committee, which obviously was what prompted us to do this podcast in the first place. And maybe I think you want to talk about HPV. So there's quite some good news around that. We will massively touch on infected blood today, which has happened only a week ago, believe it or not. Jersey.
Well, it happened 40 years ago, Steve, but yeah, the report finally came out.
Yeah, ridiculous. We're talking about Jersey and assisted suicide, a bit about junior doctors, and then we've got some stuff in pod surgery. But obviously the big news of the last week is that after all the speculation and all of the teasing and all of the setting us up to cancel it by the opposition, the Prime Minister last Wednesday went and called a general election. You saw it coming, I presume, Helen, and predicted it.
Not precisely, Steve. No, we've all been through a roller coaster, haven't we, wondering when it was going to be. And it's going to be a pretty sober list of topics this week. So I think it's important that we finish on a lighter note when we get there. But, the sudden announcement of the general election is just massive transformation for us all in our working lives and what's going on. And not least because all the media coverage we're going to see in the next 6 weeks. But out in healthcare, it's the uncertainty. It's the where we are now, where we're going to be, what the changes are going to mean for everybody. But I mean, my day got totally distracted on Wednesday once the muttering started. It was first thing Wednesday morning, wasn't it? It was that Jeremy Hunt interview that really set the hairs running for me when he carefully didn't exclude the possibility. And then they just built. And from mid-afternoon, social media was just going crazy about it all. So, but I mean, what on earth was it like for you in Westminster? I just can't imagine how crazy it is.
Well, look, I mean, there's the political and then there's the personal. And of course, as ever in politics, nobody remembers the latter. But there are people involved here. There are people, there are salaries, there are families, there are careers. And, what they forget is that, people who work for MPs, they end up having their plans changed sooner than they thought. All special advisors in government, if the Prime Minister were to leave office, they're all gone. There's human stories here as well. On the political, I mean, look, when we got up on Monday morning, the infected blood report was published. I went to Westminster as normal. When I got up on Tuesday morning, I chaired the Select Committee as normal. When I got up on Wednesday morning, I went to the members' tea room in the House of Commons, as I always do, to have my breakfast, and nobody was talking about potential election. This was Wednesday morning. Yeah. It was then really only as the morning went on that, and we've, for the last few months, at least, we've had these sort of rumours, is there an election going to be called, kicking around, and they've always been put out, if you like, by Number 10. And the political journalists were saying, this one feels different. They haven't stamped on this one. They're just not saying anything. And that's usually a sign something's up. And, and then it became pretty obvious. I mean, I suppose looking back, it's a bit like Saltburn the film. Bear with me here, Helen. Bear with me.
Okay.
If you haven't seen Saltburn the film, OMG. Anyway,
Yeah,
at the end of Saltburn, various things happen. They have a little bit of a recap and a flashback. You think, he stuck the pin in the tire. Oh, I see now. I see why he was a massive psycho. And looking back, there were so many things that were said in private meetings that I was in Number 10, or conversations with the party HQ. The Prime Minister with his second half of the year. Well, of course, July the 4th is the second half of the year. Looking back, you can piece it together and see that maybe there was always a plan to go for a summer election. I just rather naively thought that once we got past there being no election on the 2nd of May, that, well, if you're going to go in the spring summer, you'll go on the 2nd of May when all the other councillor seats and mayoralties are up for election. So, I rather stupidly thought that moment had passed and that we were on for the autumn, but alas not, and the country will go to the polls on July the 4th.
And we've alluded to the change in the upheaval. So, I mean, I think it seems appropriate for us to reflect on what the current government achieved in terms of health, what other parties have been asking for, which hasn't happened, and how things might change going forward. So, I mean, this is your territory, not mine, Steve. But what do you think the government has done well in the last?
But as ever, what we think and reflect of each other is why this works. I suppose, and this is no political judgment that I'm making here. When we're not saying, what the government have achieved because the government's over and the government's going to lose. It's an election. No votes have been cast. I'm sure I know the media have a narrative they wish to pursue, but you know what? The future's not written yet.
Right.
And the polls have already tightened in the start of the campaign. So anything is possible. Clearly, there is one outcome that is still the most likely. But whatever happens after the next election, if Rishi Sunak were to get re-elected, the Conservative Party is going to be very different. And therefore, the Conservative government would be very different too. Equally, obviously, if there's a change to a Labour government, very different. And let's not rule out there being a hung parliament and some sort of coalition, which would be very, very different again. So, I look back on 5 prime ministers which I've served. I look back on 7 health secretaries, starting with Andrew Lansley, ending now with Victoria Atkins. And I suppose, it's a history of record funding. Yeah, I mean, there is no question that day-to-day NHS spending has gone up from it's about 162.5 billion pounds in 24-25, and it was 94 billion pounds when this government took office. So, despite inflation, that's a big real terms increase of about a quarter. And, you can't deny that. But then, of course, you've got all of the other challenges that sit alongside it. So on funding, I'm giving you the facts, but out there in doctor world, GP land, it doesn't feel like that, does it? It's a bit like the inflation figures. They've come down to 2.3%, but do people feel better off? I'm guessing GPs wouldn't be sitting there today saying, thank goodness we've got record funding.
Yeah, absolutely. So look, during that time, those last 14 years, I mean, so let's talk about funding first. And I was chair of the Royal College of GPs for 3 years at that time, 2016 to 2019. And during that time, we helped land that huge additional investment into general practice, for example, the biggest single additional investment there's ever been, and this massive investment in additional workforce. But there was always the inexorable increase in population age. The demographics have been shifting quite dramatically in those last 14 years in terms of our aging population. There's been so much more we can do for people in terms of chronic disease management. So a lot more people have a label, a diagnosis, and medications that they need and manage. Amazing new drugs and therapies have come online, which have significant costs involved. I mean, some of the cancer therapeutics are, major leaps forward, but actually cost tens of thousands of pounds per person. And that's just the reality of it. And the population has grown significantly in that time. So you put all those together, and that negates, and of course, inflation, obviously, negates a significant proportion of the additional investment. Now, some stuff has happened well, and there's been a lot of investment into NHS estate, into technology and computing and so on to make our lives easier and better. But I think you'd be hard pushed to find any frontline clinicians who say, yeah, we're so much better off than we were 14 years ago. You're right. It's the difference of what it feels like, what the accountants will tell us versus what the lived reality is. And that's a challenge. That's going to be a challenge for any government. And you mentioned the possibility of a hung parliament and a coalition of some description. And I mean, I'm sure you and I both clearly remember the previous time we had a coalition. Actually, that was a really good outcome for healthcare. The NHS did well at that time. It was a bit of a turning point to change things because of public pressure. But I'm not sure that would be the case this time.
No. And if we then turn to workforce, to people, there are more staff working in the NHS now than there ever have been. That includes doctors, that includes nurses. I think the figures are there's just over 300,000 more people working in the NHS than there were. Now there will be people on the right who will say, and that's too many. But I've not yet worked in a health setting or visited a health setting where they've said we're just overrun with staff. But if you look, then last year we published the NHS long-term workforce plan, which, as you know, we talked a lot about on the podcast, was the BMA's number one ask alongside pension reform. So there's all these plans in place now to train more of the workforce. But that's the positive side of that ledger. The challenge is, one of the great sadnesses for me that Parliament has ended so soon is that, although I chair the Health Committee, I was guesting on the Public Accounts Committee, and we were about to have a session with the permanent secretary of the department, Chris Wormold, been there years, plus Amanda Pritchard from the NHS, who obviously well, plus a very senior official at the Treasury, who basically is the person who holds the NHS in the palm of their hand. Very rare that they appear before select committee sessions, and we were about to have a session where we were going to dig right into workforce. And really where I would want to go on that, and I will say it now, is that the long-term workforce plan is great in that, it's there, it's real, it's funded, it's got some brilliant ambitions in it. But a lot of those ambitions are underpinned by the NHS improving its productivity. Now, you will know NHS England's board papers from earlier this month, May, said that the NHS is still suffering a big post-pandemic hangover when it comes to productivity. Now, this is because of aging capital estate. It's to do with digital infrastructure that's still not, although better, not where it should be, and various other reasons. But if we don't meet these productivity gains in the NHS, then the workforce plan, all the assumptions that underpin it, fall apart. Does that make sense?
Totally. And I mean, I would echo this from the front line. And actually, those within the system are desperate for those things to be addressed, for the hangover to be cured, because perhaps a reflection. When I became chair of the Academy of Medical Royal Colleges in 2020, I suddenly took a much deeper and more active interest in what other medical disciplines were doing. Up until then, my focus had always been on general practice, albeit at the sort of national level. And realizing that at that point, around 15% of hospitals didn't have an electronic patient record was a complete mind-blowing thing for me to discover they were still reliant on paper notes, with all the inefficiencies and errors that can bring in. Whereas in general practice, everybody moved lock, stock and barrel by 2004 when the last new GP contract had come in, and most of us had been starting from the late 80s, these digital records, things like that. We always think of our hospitals as being full of shiny new tech, and then discovering that actually some things are still very basic and primitive was really interesting. So legacy things have been a big challenge. And of course, actually, this isn't a criticism, this is an observation, but politicians and governments want to give things that people can touch and feel and see in the short term within election cycles, and rather than invest for the long term. So infrastructure, education, estates always get pushed to the back of the queue. They're not the priority until something awful like the Rack Concrete crisis happens, or you get a major data breach or something, and suddenly priorities get shifted. But I think this is one of the, I'm now on the board of NHS England, and I'm very careful not to talk about board matters here, but it is something that frontline clinicians have a responsibility to keep reminding both politicians and NHS management and Treasury about these challenges.
Yeah. You talk about cancer. And then we'll come on to the elephant in the room, which is, of course, COVID. In the last 14 years, it is true. Survival rates have been improving for pretty much all cancers across all the demographics. Yeah. I think it's 70+% now survive a year after diagnosis, which is the big 12-month milestone. You've got the targeted lung cancer screening program in England, which will detect a lot of lung cancers at very early stage, and we still have the ambition around 75% of cancers, which I wrote in government, being detected at stage 1 or stage 2. So, you know, there've been big jumps forward in terms of cancer detection and then early treatment.
Yeah.
And I suppose what we would say, wouldn't we, prevention is the new cure, is that's the positive side. The negative side of the ledger is that we are still not anywhere near on the ballpark in terms of preventing preventable cancers. And that hasn't changed, has it?
But there's some really interesting stuff in that space. So, you know, HPV vaccine, we're going to come and talk about later. But I mean, talk about the ultimate prevention of cancer. And I'll give you some data on that one in a while. But also in this space, you know, the NHS has partly involved in this massive trial of the Grail Gallery genomics testing for multiple cancers simultaneously on a simple blood test. Now, results of that will be known, or provisional decision will be made in the next couple of months by the NHS as to whether they're going to expand that pilot massively. And the full trial won't report for another year or two. But, you know, so early detection, there's some exciting stuff happening. And actually, in the innovation and embracing new technologies and opportunities space in health tech, and AI opportunities. And actually, a lot has happened in the last, particularly 5 years, I would say. You know, we've had the establishment of Genomics England. We've had a lot more involvement in the NHS, working in partnership with the independent sector to do research in the NHS, recognising the NHS will never be able to afford to run this sort of major research. You need big pharma and big med tech to do the funding, but the NHS has the infrastructure, the people and the patients to make it work. And you can have situations where everyone wins, so long as you get the ethics and the governance absolutely spot on.
Just sticking with cancer and prevention of, you know, if only we had somebody with a plan to take a world leading approach on smoking, Helen.
Oh, Steve, don't.
So let me explain what my sarcasm is. At the end of a Parliament, when an election is announced, Parliament prorogues before it dissolves. And before you can prorogue, you go into what's called wash up, where legislation that is currently being debated, not yet completed and given royal assent, the two parties across the two houses have a wash up. They have an agreement where they work it out through the usual channels, what's going to survive, what's going to be thrown over the side. And what was thrown over the side was not the compensation scheme for the postmasters or the infected blood victims, which we'll come on to.
Thank goodness for that.
But the smoking and vapes bill didn't make it out of wash up. So the official reason that's given is that it had second reading in the House, which we talked about. It had committee stage in the House. It hadn't had report stage or third reading, and it hadn't even started in the Lords. And I can see that, you know, it has to go a certain distance before it could be considered for wash up. It has to have had some level of debate. But the fact is, Helen, this was the Prime Minister's big thing. You know, he made this a centerpiece of his conference speech last autumn. And this was his thing. And it has not survived into wash up. So annoyed.com. I think you're with me there, aren't you?
I'm annoyed, but I'm worse than annoyed. I'm sad. I'm upset. I'm disappointed, which is a very powerful word in this situation.
Yes, I mean, I'm not annoyed. I'm just disappointed.
It was, you know, the Prime Minister mentioned it in his speech at the steps of number 10 when he was announcing the general election. So I thought, right, well, hallelujah, that one's going through. So yeah, I am disappointed and frustrated. However, what I would say on this one, this really does have cross-government support, and Labour have pledged that if they're elected, that they will see this through. So I just think it's going to be delayed, because it's certainly not going to be a first 100 days priority for a new government. But I think it's beholden on all of us who care about health prevention to keep pushing in this space. I mean, Deborah Arnott, the outgoing chief executive of ASH, she's sort of been campaigning and lobbying on this for decades. And I just thought the timing with her leading, and, you know, she's been a friend to our podcast over the years, she wanted this over the line. We all wanted this over the line. You've got teenage kids, Steve. You know, this matters.
Yeah, she was texting me quite a lot on Thursday, Friday last week. You know, what's happening? Is it going to survive? And I'm gutted for her. But, you know, you mentioned my teenage kids. So my 13-year-old son said to me when I told him about the smoking bill, and he'd obviously heard it on the media that it wasn't going to be proceeded with. He said to me, "Oh, so does that mean it's okay that I can buy cigarettes then when I get to 18?" And he was being tongue in cheek, as he is. I don't know where he gets it from, but he, touche, William, right?
Yeah.
Because as I said in the second reading speech, the point of the legislation is that when you get to 18, the state won't say it's okay for you to buy cigarettes. And unless this legislation goes through, the state will basically say it's okay for you to buy cigarettes. And it's not. So, I had a conversation with a very senior Labour figure last week, and they said to me that, yes, if they are elected, they will pick this up. Whether it can be picked up at the stage it got to, I don't think it can. I think it has to start again, and they would want to change it themselves. But, obviously, if Rishi Sunak's re-elected, he'll pick it up himself. But very disappointed about that. Anyway, we sort of diverted into wash up there. I mean, just a couple other things on reflections of the last 14 years in health. I mean, I suppose mental health support, particularly for young people, expanding those services in England anyway, so that there is mental health support in all schools and colleges. That's the aim. We're not there yet. Trying to have a new suicide prevention strategy for England, and just trying to deal with these low-level mental health anxiety challenges before they become something more. That has been a focus of the government. You can't question their motives in that. But I suppose, again, lived experience out there on the streets for parents with teenagers, I wonder whether if you went out and vox pops parents on the street, they'd say, yeah, my daughter had an anxiety problem. We got CAMHS support promptly and quickly and stopped it becoming something worse. I don't think you would hear that, would you?
I think you'd hear a mixed story, would be fair to say. I mean, there's far more accessibility of mental health support for young people, for everybody, than there was. And I think for me, the big thing is we have a much more open narrative about these things. I mean, 14 years ago, no sports personality or major public figure would be talking about their mental health. And if you think how that narrative has changed over time, I think that's important. And it has meant a lot more people have come forward seeking help. So the increased resources and the number that were there have actually been a bit swamped. But in terms of throughput, there is a lot more. But you're right, Steve. I mean, people only really appreciate excellent service. Good enough isn't usually good enough for people. And that's a really interesting thing. I mean, I was just reflecting as you were saying that about the other conditions that have the last 14 years have really changed the narrative, and there's been a lot more resource that NHS input into. And I was just jotting them down as you were speaking. I've written down here gender incongruence, so gender identity challenges, autism and the whole autism spectrum of conditions, eating disorders, anaphylaxis, and also personality disorders. So there's a whole heap of things that, we've got ADHD, we've got all sorts of things where we didn't talk about. These were all hidden. I mean, obviously there's menopause and periods and all sorts of things where I think the public we've got a much better discourse about these things. Whether we've improved the care for people to the extent we want to, I think there's still a long way to go. And this is why, and I'd like to bring us on to what the Health Select Committee's achieved over time and what you're proudest of there. Because actually, the reason I agreed to this podcast with you is that it would be cross-parliamentary. It would not be, I mean, I've never nailed my colours to a political party mast and don't intend to do so. I vote in private. But it's been important to me that we can bring people in from different parties and perspectives and have that. And your work at the Select Committee brings that together. I know that's been incredibly rewarding for you.
Yeah, definitely. And we've sort of taken on some of the things that I did in government. And because I've tried to work cross-party over the years, the only reason why I got elected as the chair of the Select Committee is because it's an election of the whole House, and you have to get other parties to vote for you. And they don't do that if they think you're an attack dog partisan figure. Yeah. So, we've taken on some stuff that I'd started in government, which I'm really proud of, actually. And, we should probably conclude on our look back at government with primary care, in that what we did around Pharmacy First, which I'd started the pilots of in the northeast of England back in 2017. Pharmacy First is, I think, now well embedded in the system. I know there are frustrations out there in primary care land about it, but I don't see that going backwards. I see that only going forward as it's ongoing reviewed. And, you've now got all these different conditions that are checked out, the 7 different conditions that are checked out in the sort of one-stop shop of community pharmacy. And I'm really pleased with that. On select committee, I mean, yeah, gosh, where do we even start? I mean, one of the things that I am most proud of, I suppose, is that because the select committee can do what it can do, and it can scrutinise stuff that it decides to, it can also scrutinise ministers.
Yeah.
You think of the big report that we were doing on future cancer, which won't now be published because there wasn't time. This is no way to run a parliament, in my opinion.
Yeah.
But there'll be a kind of summary of it that will be published in a letter to the Secretary of State next week. You've got big reports like assisted dying, assisted suicide, which I know we're going to come and talk on in a different context. You've got a big pharmacy report, which will be published today, actually, as we record this on Tuesday, 28th of May, which we managed to agree last week before Parliament prorogued. And then you've got other big piece of work around integrated care systems, around digital transformation in the NHS, stuff that I think will actually stand the test of time. And I hope future ministers will look back on some of that work, which was very, very carefully evidence-based, and decide to use that as maybe a pool of ideas for things they want to do. But I mean, select committees are the great kept secret of Parliament, and chairing one has been a great pleasure.
I mean, to be honest with you, the more I've got to know about how our government really works, as opposed to that sort of superficial insight that I had previously, I think select committees are one of the most important things we have in Parliament in terms of actually getting high quality stuff done. Anyway, that's not the focus of the podcast. Let's move on, Steve.
But in terms of where next, Helen, obviously there's a campaign to come, and we talked about Labour's excellent plan on prevention, which they've talked about, and we hopefully that will make it through into their manifesto. Just in terms of what do you think will be the big health themes when there's a health day in the grid and everyone's talking about health? What do you think will be the big themes of healthcare during this campaign? And do you have hope that it will be an enlightened conversation as opposed to just we've got a secret plan that Tories are going to privatise the NHS, or we've got a secret plan that Labour won't carry through the new hospitals programme? Will it rise above?
My fear is that it won't. I suspect it won't, and that disappoints me, because I know there are excellent people on all sides of political parties who want to do the right thing in terms of health, who completely get that the obvious thing to do for a new government, if a new government is confident about its future and it intends to be at least around for 2 terms to get stuff done, then actually it's prevention they absolutely should be focusing on. If you want to make the NHS sustainable for the future, you have to move things upstream, prevent disease at source. You've heard me ranting on about this for the last 18 months or so, but I fear that it'll descend into the sort of mudslinging, backbiting, schoolyard name-calling nonsense that we've had in some previous elections, which will be frustrating to all of us who really want to get good stuff done. Sorry.
Say what you think.
Well, you did ask.
I did ask. I mean, where I hope it will go with the next government is that, if you think about I discussed this a bit when Lord Bethell was guest presenting with me when you were away, is that, when you think about the way that a private insurance model works in the healthcare world, it's that they try to make sure that their customers, their clients, remain healthy, because that's good business and stops them requiring cost and their services. We have something in this country called national insurance. It's literally called that.
Literally, yeah.
And yet we don't behave like a state national insurer and look after the health of the population so that they don't then become a customer at the front end. And I would love to think that the next government will embrace the idea of a national insurance model. This is not about the way the NHS is paid for. It should remain a public service free at the point of use, in my opinion. And there are other views are available. But it is
that this podcast there aren't.
No, we should use big data, not sell big data, and use it as a predictor of ill health as much as you can. And that would be a national insurance model. Now, wouldn't that be an enlightened view of healthcare?
Too right. I mean, embrace our public health physicians and what they're saying to us. And also, I feel strongly about the sort of the social side of things, and social prescribing is my other passion, and how, as a wider society, we can do things better. So anyway, let's live in hope, Steve. Let's live in hope. Can we finish just before we take
Yes.
HPV vaccine and your work on HPV vaccine? I want to tell you publicly how happy and proud I am with the work you've done in this space. And then I want to tell you what's on the front page of the BMJ this week.
I have the BMJ in front of me, so you can tell me and save me reading it.
we can we can wave our copies at each other as we're recording this separately. Yes, look, HPV vaccine. There's just been a really great piece of research done, looking an observational study, looking at what's happened since the implementation of the vaccine. This is just in girls and young women, but essentially saying that 687 full-blown cancers have been prevented, and over 23,000 women have been saved from CIN3, which is a is a precancerous, but advanced precancerous change, and it requires quite unpleasant treatment to exclude it. I mean, that is really, really big and important. And there's always a deprivation gradient with cancers. So women from the most deprived parts of society have benefited greatest from this. And yeah, lovely to have a success story.
Yeah, I mean, it says in the piece, HPV vaccination was associated with a substantially reduced incidence of cervical cancer. And this was, the evidence was clear, and this is why we did it. And it was quite a battle. It was quite a battle to get a new national program rolled out to teenage boys for the HPV vaccine, because girls obviously had it anyway. As I said in the house the other day, my teenage son was not thanking me when he and his friends had to have a needle in the arm the other day. But there is a greater good here. Vaccination is it. So very proud of that. If people want to read the article, I presume it's probably behind a bit of a paywall. But
no, I think it's a freely available one.
Is it? Okay. Well, if we put the link on social media, but it's the BMJ, the British Medical Journal, big lead story in their recent edition on HPV. Should we take a break and then we'll talk about the big story of the last week that isn't general election?
So, welcome back. It's our other big story that we promised to talk about, which is the infected blood inquiry. Now, Steve, I know that you've been actively involved in this and pushing for this over the years. It's been an issue all our adult lives, I was reflecting this morning. So tell me about it from your side.
I mean, yeah, literally my whole life, because of course I'm 50 this year, or have already been 50 this year. I know I don't look it. But yeah, and you look back to the infected blood scandal of the 70s and the 80s, and we set up an inquiry which was to, and I quote, examine why men, women and children in the UK were given infected blood and or infected blood products, the impact on their families, how the authorities responded, the nature of any support provided following infection, questions of consent, and whether there was a cover-up. And the answer to the last question seems to be an unequivocal yes. So Sir Brian Langstaff, who I don't know well, has produced this incredible report last Monday in another time. On the 20th of May, he had this big event at Central Hall in Westminster when he received a rock star welcome from everybody there, and outlined in the most incredible way. He's got a great bedside manner, Brian. In the most incredible way, he outlined the findings of his report, what he think went wrong, who was complicit in terms of the organizations, whether there are individual prosecutions, that remains to be seen. I wouldn't be surprised. And then the Prime Minister responded last Monday afternoon, making an apology on behalf of the nation in the House of Commons. I was obviously there for that. And then the very next day, the Paymaster General, John Glenn, the MP for Salisbury, set out the compensation scheme. And, you could have heard a pin drop in the House on both those days. I was there. I spoke on Radio 4 on Monday lunchtime. I spoke on Newsnight on Monday night. And obviously, I've met many people, victims of this over the years. I guess you have, in a clinical setting, met people affected?
Yeah, I mean, like over 30,000 people have been infected with HIV and hepatitis from sort of the early 70s to early 90s through this. So, yes, I have come across it, although not many cases, because, it's still, it's all relative, isn't it? In terms of, I don't think we've got anybody in our patient population, for example, but we all know somebody who knows somebody, and we all know in the health system people who've been involved in it. And I mean, this is being called the worst treatment disaster in the history of the NHS. And that's sobering for every one of us who works in the NHS, people who work in the Department of Health, as well as government, as to about how badly wrong it went. And it's, I'll give a personal reflection. My husband was involved in a pretty bad road traffic accident in the late 90s and needed blood transfusion, and I had to consent because he was unconscious at the time. And I remember the whole thing thinking, I mean, I was a junior doctor at the time. I was working in obstetrics and gynecology, and I'd given blood to plenty of women in in childbirth had bled heavily. And this was big news back then. I remember thinking, double checking, of course this blood is safe for my husband to have. Of course this blood is safe for my patients to have. But it was weighing on our minds back then. And I think when I was chair of the Royal College of GPs, the inquiry was starting, and we were very cooperative with what had happened, because although GPs never give blood products, we were there often with the families and the counselling side of it. And there will be situations where GPs won't have had the information at their fingertips, or won't have thought to test people. I mean, that was probably the big thing, that there are people who lived with these things, the infections, for a long time without any way of testing them. But of course, paper records, no way of searching back to find patients who might have had transfusions. I mean, yeah, so many layers to this. But Brian Langstaff's report, I mean, it's thousands of pages overall. I mean, it's 7 volumes. I mean,
it's 7 volumes. It's 2,500 pages. Yeah.
Anyway, so look, I'm glad that we've got the report. I'm so glad the legislation has gone through in the wash up. I mean,
yeah,
that and the post office. I mean, goodness, that would have been appalling if that hadn't happened.
So I think some victims could receive up to just around £2 million on the compensation. The first payments are going to be made by the end of the year.
Good.
And then there'll be extra interim payments made over this summer for those that are most affected. But the compensation is going to change, so it'll eventually be made available to a much wider group of people, Helen. So we're talking about the family and loved ones of those who've been affected, children or parents, right, people who've cared for people impacted by this. So, and this is where there is then scrutiny needed by the next Parliament, is because I'm not so worried about the infected getting the compensation, because it is a matter of clinical fact that you're infected. The challenge is the affected, and where you draw the line on that, and how, what if you drove somebody to school several times because they were unable to get to school by any other way? Does that mean that you're part of the caring group that help people who are infected? You can see how it could get very, very confused and very, very bureaucratic, and that's what we want to avoid, because I had a constituent affected by this who passed away relatively recently, actually. And I think that a lot of people have died. People are dying now, and time is not on their side. So I think the total cost of this, I think Jeremy Hunt is probably conservative as an estimation here. The total cost of this could be around £10 billion. So there's big sums, but it's one of, the Prime Minister said, look, there has been state failure on a massive scale here, and we will pay whatever it takes to put this right. And I believe in his heart, he's right. He's got the right heart on this. And I'm very sure that Starmer, if he becomes Prime Minister, would have too. So we will put the state will correct its failing, but it can't undo the past.
It can't, and there's decades of harm here. But we must move on, because I'm conscious of time, Steve. But I think, just to finish with that, I mean, there must be lessons for governments here, that when things go badly wrong, and it is obvious to everyone the compensation will need to be paid to people who have suffered, that we should crack on and do these things soon. I mean, the UK is a laggard with this infected blood inquiry compared to some other countries in the world.
Yeah, and I said on the media last Monday that, the way I've reflected on this a lot, and there's 3 ways of looking at it, right? Is it that this is a new country, and we're not very good at statecraft, and we're actually quite new to statehood? Clearly not. Clearly not. Is it that we don't have good people in this country who can get to the bottom of problems and work them out? Well, obviously not. Brian Langstaff is a good example of that. So you really only come down to one other way of looking at it, which is that this is systemic cover-up by the state, by people, by public servants who closed ranks to protect each other from mistakes. And that is what Sir Brian says in his report. And the state has to be better at this. And it's really, really bad. And the post office is another example of something that was covered up, took way too long to come out. Meanwhile, more hurt is implemented, and more people die.
Right, moving on. And from dying to dying, perhaps?
Yes, to dying well. Of course, other views differ. Jersey politicians, Helen, have voted to approve plans to allow assisted dying for those with a terminal illness, quotes, causing unbearable suffering. So the States Assembly, it's called, it's been debating two routes through which people who have lived in Jersey for longer than a year, so you can't move there, do this. 18, you've got to be 18 and over and have a decision-making capacity. You could apply for assisted dying. 32 members voted in favour, 14 voted against. So we're not talking big numbers here. But the fact is, this is a Crown dependency of the UK, which has decided to make a change in the law on this. And it could come in as soon as summer 2027. When we did our Select Committee report on assisted dying, assisted suicide, we said the UK government in London has to be prepared for should a devolved government or another Crown dependency make a different decision to the mainland. And they now have. And so we will see whether they are prepared.
So look, I mean, I don't think we should talk too long about it because we keep coming back to this, and I'm sure we will again. Interesting that they rejected an alternative route, a second route for assisted dying, which is about for those who are not terminally ill but have an incurable medical condition which causes suffering. So I think that's an interesting second question, which we'll come back to. But for me, it's about how doctors and healthcare professionals feel about it, and people are deeply divided on the issue. People are really quite polarized. There's the clear argument about this is all about prevention of harm, relief of suffering, and letting people have control at a time in their lives where generally they have little control over their health and well-being. But others who strongly feel this is completely morally and ethically unacceptable. As our role as doctors and healthcare professionals is to do all we can to save and prolong life, not to end it. So it's a really difficult one, but there is one thing that everybody agrees on, and that is that end-of-life healthcare services, palliative care, hospices, community nursing teams need to be supported and bolstered so we give the best possible care we can to everybody at the end of life, whether or not the assisted dying route becomes more available.
Yeah, and I think the reason why they were right to reject plans for that people who are not terminally ill but who have an incurable medical condition causing unbearable suffering is that you could have diabetes. It is an incurable. It can be type 1 can be an incurable condition. If you didn't treat it, it would cause you unbearable suffering. But we can treat it. So and you could make the same argument as is happening in other parts of the world around mental health conditions. That can and does cause unbearable suffering. It can be. Many people believe it to be incurable. So I think that's a grey line in this. And actually, I think the Jersey politicians have been careful in rejecting that.
Yeah, we'll come back to that another time. One last quick thing before we go to the break, and it's it's Junior Doctors Industrial Action again.
No.
And this time it's the turn of our colleagues in Northern Ireland. So last week, 2 days walkout by junior doctors in Northern Ireland just before the bank holiday. This just rolled on, doesn't it? I don't think anything's going to happen now we've got a general election happening, however.
No, I don't either. I think the BMA Junior Doctors Committee are waiting for a new government to do negotiations with. They expect to get a better hearing if it's a government of the centre left. I think that just remains to be seen. Who knows? Meanwhile, waiting lists grow and patients suffer, and a workforce is unhappy. It's the big challenge of the incoming government of whatever colour.
Yeah. Anyway, should we take a quick break?
Right, welcome back. This is Prevention is the New Cure podcast. Myself, Steve Brine, former MP for Winchester, former chair of the Health and Social Care Select Committee, and Dr. Helen Stokes-Lampard, who's a frontline GP, used to run the Royal College GPs, used to run the Association of Medical Royal Colleges, and numerous other things. We're going to press this button. And that means, Helen, that your surgery is open. Dr. Stokes-Lampard and Dr. Brine, brackets not really a doctor, are in the surgery.
Yeah, we're going to make it a short surgery today, Steve.
What have you got?
I think I'd like to start by talking a little bit about sepsis, and I'd like us to perhaps talk a little bit about skin cancer. And I really want to hear a quick update on Monty after the bank holiday weekend.
Yeah. So sepsis, I presume that this Craig McKinley MP for Thanet East has spiked your interest in sepsis.
What a remarkable sight that was, and what a remarkable colleague of yours.
For those who don't know, Craig is an MP in Kent who developed sepsis very, very, very quickly. Things took a nasty turn. He ended up in hospital in intensive care. He's had both of his legs and both of his arms below the knee, below the elbow, taken off. And we just didn't know whether we'd see Craig again. Last Wednesday turned out to be the last PMQs of term. Craig came back into Parliament on his prosthetics with his prosthetic hands and arms, saying he wants to be the first bionic MP. And he walked in and received an entire House of Commons, the whole gallery, the whole press gallery, Hansard, everybody standing up, applauding him. And we never clap in House of Commons. It was the most incredible moment for him. As you can imagine, his wife and 5-year-old daughter were sitting up in the gallery, and he just stood there and waved with a bionic hand.
I mean, just awesome. I mean, it was so powerful. I mean, it was a symbol of hope for people. It was a symbol of courage. I mean, it was also remarkable in terms of the medical endeavours that went to get him to this point. I mean, you know, statistically, he should not have survived given how ill he was and the degree of the gangrene and so on. So a lovely turnaround. But I mean, sepsis is a terrible condition, and we've touched on it before. And we can justify talking about prevention, about sepsis, because there is definitely a prevention angle, because sepsis is always triggered by infection, you know, overwhelming response to infection. You know a bit about this, don't you?
Not really. I mean, where would you pick up an infection then that could lead to sepsis? What typically would that be?
The crazy thing is, it can be anything, Steve. I mean,
Well, that's scary.
It is. It's surprisingly indiscriminate. So any infection can suddenly trigger an atypical response to infection. So when body effectively injures its own organs and tissues, the immune system just goes into complete overdrive, which leads the body into the medical condition of shock. You get organ failure. And if you don't recognize what's going on, it can lead to death. You know, it is very much a major problem. And it's certainly worse in very young children and older adults, but as Craig McKinley demonstrated, it can affect anybody. You know, anything. I mean, chest infection, urine infection, and so on. But all healthcare professionals receive specific training about sepsis, and there's been a lot of research and publicity about it in recent years. But it does create a challenge, because the obvious thing to do is, it's usually triggered by bacterial infections, I should have said. The thing to do, of course, is to throw antibiotics at infections. And there's certainly evidence suggesting that as we've pushed harder for antimicrobial resistance, and we are less inclined to give antibiotics to usually mild infections, that the risk of sepsis setting in is higher. Because obviously, if you treat fewer of the infections and let the body get on with it, then some of them are going to turn sepsis. A tiny, tiny, tiny proportion, but it's a huge tension in general practice, and then in A&E and intensive care, as to how far you go and how hard you hit people with antibiotics because of the risk for the future.
Yeah, I mean, Craig was saying in his PMQ to Rishi Sunak that, you know, familiarize yourself with the signs and symptoms of sepsis. I mean, actually, for him, it was so quick that there really wasn't time. And as you say, he shouldn't have survived. And he says that. But, you know, for others, it is a slower burn, as it were. And, you know, you can obviously, there's good information out there online about the signs and symptoms, probably from the NHS online. But no, bless Craig. And he has subsequently announced, actually, another casualty of this general election, that he won't be standing, because he planned to come back slowly over the summer, get back into it, and then stand at the election in the autumn. And because the election's been rushed upon us, he won't be standing, which is a real shame. But a nice chap, and lovely family, lovely young daughter, who he said to me, you know, she took it in her stride. You know what kids are like, just took it in her stride. So I wish him well and his family.
And just for further reading, the UK Sepsis Trust, great charity. You've got fantastic resources about this on their website. We'll put that link in the usual socials.
And then melanoma?
Just a quick one. It's this, you know, having just had the bank holiday weekend behind us, gosh, wasn't the weather glorious?
Yeah. Yeah.
It fluctuated. 4 seasons in a day we had it in the Midlands. I was belted with hail, cowered from the lightning, and then did spend a bit of time sitting in the sun. Look, melanoma, skin cancer, is at an all-time high in the UK. Particularly affects people as they get older, but is something that can affect people at any age. a lot of melanoma skin cancer is triggered by excess sun exposure. Now, we can hypothesize why older people are getting more of it. Personally, I would imagine these are the people who were the sun worshippers in the 70s and 80s, where, you know, the concept of suntan lotion was a novelty. And if you did, then you reached for the factor 2 or the factor 4. And, you know, I certainly remember people I know reaching for the sun bronzing oil to accelerate the speed at which you got a tan and not block anything. So, you know, just remember, it is very much a preventable condition for most people. And there are a whole heap of other lower grade skin cancers that are similarly triggered by sun exposure.
Yeah, I'd never use that oil. I wouldn't want it to stain my trunks.
No, let's move on, Steve.
So I'm just giving I just left that gap there for that visual image.
Yeah, it's just, yeah.
Anyway, just before we close on Monty, so there is a silver lining to a general election being called, Helen. Let me tell you that there is one thing, big black Labrador thing, who's very happy about this election being called, is Monty, because it means the daddy's home. So yeah, daddy's home. He spent the weekend watching. Well, he watched my son play cricket. Who for his first ever cricket match bowled and caught. Don't really understand cricket, but I think that's good. And in his first ever over bowling, and Monty sits and watch cricket, but he can't. He's just like a child. He can't watch and just watch it. He has to be involved. So we've had barking, crying, whining throughout William being on the cricket pitch. In the end, I had to walk him away from the pitch because he was disturbing the bowling. But yeah, he's very happy about Daddy being home.
Well, I'm glad there are some silver linings to this general election.
Yeah. We will be back in 2 weeks' time. For those wondering what happens with the podcast now that, you know, Parliament is not sitting, for now at least anyway, the podcast continues on its fortnightly rhythm. And in fact, in 2 weeks' time, it will be Men's Health Week, Helen, and I am trying to line us up a good guest to talk about some men's health issues.
Excellent. It's about time we talked about men's health again, so that'd be good.
Yeah, it really is. Yeah.
Look after yourself. And
yeah, God bless.
Everyone affected by the election and uncertainties and so on, take care of yourselves. It's a time to be kind to one another.
Indeed. Until next time, podcast@stevebryan.com. Find us on all of our social channels, and we'll see you again. Bye.
Bye-bye.